Hi, my name is Christian. I'm the This is Public Health Ambassador from the University of Alabama at Birmingham, and I'm here today with Candace Rachel from the Jefferson County Department of Health.
Hi, my name is Candace Rachel. I'm the Rapid Response Coordinator and a registered nurse at Jefferson County Department of Health.
So what is it exactly that your program does?
So our program does a lot of different things. We received the OD2A grant, which was the program that it was a grant funded. We were subrecipients of the monies from the Alabama Department of Public Health. So we received money from a grant, and we were able to go out into the community, provide naloxone or Narcan to the public, and do training. We've also been able to help develop a curriculum for free CEs in partnership with UAB, called allahope.org, and that's also in partnership with Auburn School of Pharmacy. And you can get free CEs and CEUs, and it's social workers, anybody with a professional license that needs to get CEs is free. We also go out to schools. We go out into communities with businesses that want to learn about the opioid crisis and how that came about. We work with individuals to help them learn about addiction. We work with partners, community partners that connect people with resources for treatment. So many things. I couldn't even begin to tell you.
So what is one of the biggest challenges that you and your team face?
So one of the biggest challenges is stigma. We still have a lot of stigma, which is there's this, and I'm not saying that in a blaming way of any sorts. I think everybody has a natural bias that is internal in them that they may not even realize, and I'm in that boat too. I carry it too. I think everybody has a perception of what addiction looks like and what somebody that uses drugs looks like, and they have their opinion. If they don't do it, then it won't be a problem. They should just quit. A lot even in the medical community, it's like that. And in some instances, like at the very beginning of somebody's addiction or somebody's drug use, it is a choice, but after it progresses, it's not a choice any longer. So I think one of the biggest hurdles that we do face is trying to allow people to understand really what addiction is, but they have to try and understand it.
And what are some ways that you guys combat stigma?
Well, we do a lot of different things. A lot of it's education. It could be anybody's child. It could be anybody's sister, brother, friend, partner, husband, wife. Addiction and overdose has no boundaries as far as race, social, economic background, how many, male, female, sexual preference, none of that. It is non-biased, 100% non-discriminatory. So one of the biggest things is we just try to go out to different areas of our community and educate them on what can be real in their lives. And one of the ways that we do that is we take people that are in long-term recovery, because they don't realize they're in long-term recovery. And then when we have them, when we introduce them, we don't tell them right away, and then that individual gives them their story. And for them to see somebody in recovery that they would have never known had an addiction and lived on the street and was saved by Narcan multiple times and have been in treatment multiple times, have been in jail, have been in treatment facilities. For them to see somebody on that other side, and they already have that perception that that person is not somebody that ever used before, because they don't look the part. And so that helps with some stigma.
If there was one thing that you wish the general public knew about addiction or overdoses or just naloxone, what would that be?
One, naloxone is very safe. About naloxone, I would want everybody to have naloxone. Individuals will say, well, I don't need naloxone, I don't use street drugs, or I don't use anything. Well, that's great, and I'm glad, but the people that are using the drugs that need the naloxone are not the individuals that are going to give themselves naloxone. So we want people of the general public to at least learn how to use it, to be able to, even if they're not willing to administer it, if they have it, to give it to somebody that would be. And when I say give it, like if they're at the park and they are carrying a Narcan kit, but they're not able to mentally administer Narcan, because some people just are not emergency responders, and that's okay. But they may be beside somebody that is emergency responder who doesn't have Narcan, and they can say, well, here, go give them this. I'm going to go call 911, get some help for what I would want them to know about addiction. And, you know, I can talk all day, but I mean, I was talking to Dr. Traffenstead, who's our medical director, the other day about how even from the beginning when we started working on our grant on the program, the way that I looked at addiction then to how I look at it now is completely different. Part of it, a lot of it is because I've been in contact with individuals that are in the middle of their addiction, that are in the middle of their recovery, or that are just starting recovery, or just starting addiction. How that process works. How did they start to turn to a substance to ease their pain, whatever pain it is? It's not like, you know, they wanted to take a substance usually to ease some sort of pain, whether it be physical, mental, emotional, whatever it was, there's a reason. And how they have progressed through it is no longer a choice of stopping, just stopping. And I would love for the general public to really either go to a 12-step program meeting, whether it be Celebrate Recovery program in a church, just to visit, to talk to somebody who is going through recovery or treatment, or that can really share their story.
What is one thing that the general public could do to help your cause?
So one of the biggest things is to educate themselves. If somebody, you know, a lot of times people will be talking negatively about, you know, the addict or the alcoholic, and maybe stand up for them. Maybe not, you know, say, you know, what can we do to help them? What is it, what kind of support do they need? What is it that we can provide for them that will help them get into a treatment program? Or at least maybe help them start thinking about getting into a treatment program. Just because you suggest somebody goes to treatment, or you have an opportunity to send them to treatment, doesn't necessarily mean that they're ready for treatment. So don't try to fix them with your ideas. Give them the support that they need and the love and care and kindness with individuals. You know, some of them aren't out on the street, some of them are on the street, some of them aren't. So it's important that you treat everybody as a human being. They're all worth it, every one of them.
Awesome. Well, thank you for your time. I really appreciate you doing this and spreading some knowledge.
Thank you. So I do want to mention, if I can, International Overdose Awareness Day is August 31st. And we are partnering with UAB, so we'll be at UAB Blazer Village, and we'll be at the game. on the 31st. And then our interns actually just put up 448 flags in front of the UAB Public Health Building this afternoon as a representation of 448 lives that we lost last year to overdose. So wear purple on August 31st.